Anneliese Dressel of the Health Hub, Times Square in Ballincollig, joining me this afternoon. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And there are lots and lots of questions in. Let us get straight to them. This was emailed in during the week. It says, hi Patricia, could you please ask Anneliese, my brother-in-law, 35-year-old fit and healthy man, has been diagnosed with a fatty liver. It presented when his doctor ran tests as he was suffering from gout on a regular basis. He's not a drinker, he's not a smoker. Now his diet wasn't great, but he has rectified that now. Any other advice to help him support his liver going forward would be most welcomed.
Absolutely. Patricia, I'm seeing loads more fatty liver than ever before, and it's actually called non-alcoholic fatty liver because a lot of people who are developing this now it's nothing to do with alcohol. Normally, you would have seen it in people who would have drank a lot of alcohol. The alcohol effectively is like a sugar. It would have been converted and stored as fat in the liver. So I think one of the biggest problems now is that it is the high fructose corn syrup and the other sugars that we're adding into our diet, and it's the low fibre, high carb foods that we're eating. So they're kind of replacing the alcohol as sugar. So our body does not like to have high blood sugar, so it takes it out very quickly and it stores it in the liver as fat, and that's how you develop fatty liver. So the diet really is key. And some people find that a low-carb diet works very well. And what that really means, Patricia, is not just eating meat and eggs only. It's actually cutting out things like bread, pasta, rice, cakes, biscuits, obviously all sugar, and living on a diet of like eggs, say, for example, for breakfast and vegetables, a salad with some good protein for lunch like chicken or fish, and then the same again for dinner. So lots of veg, lots of good quality protein. That can be very effective in managing fatty liver. And then in terms of the supplements, there's a couple of ones that work really well. The one that absolutely works brilliantly is called berberine, berberine. It disappeared off our shelves for a while, but it's back, which is fantastic. I think what happened was it was on TikTok as kind of nature's Ozempic, Patricia, so the medical board had to pull it to take a look at it. But it's back on our shelves for the time being, and it is absolutely fantastic for people who are pre-diabetic, who've got high blood sugar, and who've got fatty liver. Another very good one is something called alpha-lipoic acid. That protects the cells of the liver, as does the herb milk thistle, which a lot of people would be very familiar about for liver. So any of those and any or all of them would work extremely well, but I can't stress really enough that the diet is taking out, especially that high fructose corn syrup that's being added to all of our foods now.
Yeah, and as our listener admitted, the brother-in-law accepts his diet wasn't great, so that's the first thing. So he's well on the road to doing the right thing by changing his diet.
And the other thing I'd say there as well is that gout can be bad for people who've got a high purine diet. So the diet now I've just mentioned might not work well for this gentleman in terms of his gout. So managing that naturally would be very important. And the best thing for gout, and we've seen it time and time again, and we've loads of customers that take sour cherry juice daily. Has to be the sour one. You can get it either in juice form or you can get it in cordial form, and you can mix it up with water and drink it. And it absolutely 100% works brilliantly to flush the uric acid out of the system so you don't develop gout.
And the gout isn't linked to the liver, is it?
No, but gout can happen with people who've got a diet high in purines. Purines are a type of protein that you'd find a lot in fish and meat and eggs and cheese and all of the ones I was just mentioning on the low-carb diet. So for that gentleman, I think to be proactive and prevent the gout from taking hold would be important, so he could stay on that low-carb diet.
Okay, from Anne, what would you recommend for insomnia? Any supplements that might help?
Yeah, so there's different kind of, I suppose, types of insomnia really, Patricia. I think mostly we see it in women, and it's because they've developed this way of sleeping lightly when their children were small, and they can never fully get back into a deep sleep. And then menopause comes along and just, messes it up even further. So I think if it's a long-term sleeping issue, and if people have been dependent on sleeping tablets, there really is nothing natural that's similar to that. The natural approach works really well who have insomnia because they have a busy body, busy brain. Because what the natural things do is they work to bring down kind of adrenaline and noradrenaline that keep you awake and focused, and they kind of bring up the alpha waves and the neurotransmitters that help you feel calm and, relaxed. So that's how you get a good natural sleep. So the one that works best here in the shop is NHP Advanced Sleep Support, and that is a mix of all of the following things you can buy them separately for sleep, which is L-theanine, magnesium bisglycinate, hops are very good as well, valerian. I think there is also in there some cherry extract. There would be a melissa, which is lemon balm, the herb lemon balm. So all of these are very good for that reasons that I mentioned earlier, bringing down the stress hormones. But one of the simplest tips, actually, Patricia, is don't drink any caffeine whatsoever after 2 o'clock in the afternoon.
Just give it up, yeah.
Give it up fully,
yeah. And that includes tea, unfortunately. Marie says, question for Anneliese, please. Is there something I can take in addition to my thyroid medication? My doctor keeps telling me everything is good when I get my bloods done, but I still have many of the symptoms. I have an underactive thyroid gland, so it's obviously on Eltroxin. Anything else?
So then, well, if all the hormones look okay, then maybe it's a possibility that this lady is not converting the thyroid hormone from the Eltroxin within the cells. And that is a common issue. So we have a product here which is called T-Convert, and it has got a combination of a couple of things in there that help you, because that hormone, the thyroid hormone that you take or that we make, circulates inactively in the bloodstream, and then when you bring it into the cell, it gets converted to the active form. So if you're on the Eltroxin and you're not feeling any better, it's possibly a conversion issue. So T-Convert is the one to take for that.
Hi Anneliese, I have a lump on my forehead. It's from a sinus infection I had a few months ago. What can I do to ease the pain, and will the lump go away? I'm taking paracetamol at the moment and I have done nasal rinse. Is there anything else I can be doing?
So it's a lump on the forehead coming from the sinus?
Yeah, as a direct result of a sinus infection a few months ago.
That sounds to me like there's something, would it be either that there's a pocket up there that's filled with fluid, or would it be that it has created huge inflammation? I'm not sure really. I've never heard of anything like that before, Patricia. So what would be good for that? Well, I think possibly steaming would be very good to do it for anything to do with the sinuses and help clear them out. So just get a big bowl of very hot boiling water. I'd put in things like eucalyptus. What else is very good for that? Tea tree, peppermint even is very good. We have a lovely one here in the shop that's called Breathe Easy. It's a combination of a number of different essential oils that are great to clear out the sinuses. And the steam as well is very soothing for inflamed sinuses. So you could try something like that. I think massage, I don't know what it is. If it's filled with fluid, maybe massaging it regularly, maybe with something like, even maybe something like Vicks could help, Patricia. I don't know. I'm kind of pulling out suggestions there. Really don't know what I'm talking about, if I'm being honest, because I don't know what it is. It's a strange one.
Yeah, maybe go back to the doctor, because obviously if she had a sinus infection, she probably was on some kind of an antibiotic. Maybe go back and get the doctor they might send you on to a nose and throat, ear, nose and throat.
It might need to be drained, possibly, yeah.
Okay, actually, just back on the fatty liver for a minute. Somebody says, I was taking Nurofen Plus. I had severe knee pain. I ended up having to have a blood test and it showed I had fatty liver. I don't, by the way, drink alcohol. I came off the Nurofen Plus. They redid the blood test after a period of time and my liver was back to normal. Would the Nurofen Plus have caused fatty liver?
Well, it could definitely be linked with it, Patricia. So a lot of the markers for fatty liver are elevated liver enzymes. So they haven't actually got in to look at the fat deposits in their liver. They're just looking at particular liver enzymes that are elevated, and that's indicating you've got fatty liver. So Nurofen Plus would be very, very hard on the liver, and that's possibly why those liver enzymes would have been elevated. And, any time there is inflammation, particularly in the liver, you will get elevated liver enzymes. So that could have been the link there with the codeine, particularly in Nurofen.
That's right. And they always say to it's ibuprofen to take it with food, don't they? As opposed to with paracetamol, you can take it on an empty stomach. But ibuprofen.
Actually, the ibuprofen is very rough on the stomach, Patricia, which is why they say take it with food.
Oh, okay.
It's very rough on the stomach. But actually, paracetamol is very rough on the liver.
Oh, God.
So you need to be careful. Do not take more paracetamol than they recommend.
Yeah. For sure. Now, can you help Martin? He had a blood test done at his GP and he said, once again, I'm slightly anemic. Doctor can't find a reason and I don't have any symptoms. Some have suggested it's due to my pale Irish skin. What would Anneliese think? Any ideas to give my blood a bit of a boost?
Yeah, so anemia is generally a lack of either folate, vitamin B12 or iron. And some people are very poor at absorbing iron. One of the first things I ask Patricia if people are routinely anemic and low in iron, or B12 or folate. If they're not vegetarian, so if you're eating meat, you shouldn't be low in iron, then is it possible you might be gluten intolerant because it could be an absorption issue? Are you taking a stomach acid blocker? Because that would make it an absorption issue. People who take the stomach acid blockers are definitely more at risk of not absorbing things like calcium, zinc, iron, which, if you think about people on it long term for osteoporosis, is not a good thing. So if either of those could possibly be the reasons, you need to address those. And then take an iron supplement is probably the best. And a lot of people need vitamin B6 in order to absorb iron properly. And also, we all know vitamin C as well is important for absorbing iron. And why vitamin C is important, Patricia, again, is because of the acidification that vitamin C has with iron, because it needs to be. So if you're on an antacid, it's blocking the action of the vitamin C as well, unfortunately.
Okay.
So,
go on.
Yeah, a good supplement. We get great feedback on Nature's Plus Hemaplex. It has absolutely everything in there, including B12 and folate for your bloods, to give your blood a good boost.
Okay, you're going to love this one from Sheila that says, hi Trish, after hearing Anneliese talking about CBD oil, I thought, sure, why not? I'll give it a go. Now, it's either the most underpublished miracle of the century or it had the placebo effect on me. All I know is that since taking it, I'm sleeping better, my restless legs and busy brain has stopped, even the arthritis in my fingers isn't as painful anymore. Now, it tastes rotten, says Sheila, but a rinse round with a fizzy drink cures that. Please tell Anneliese a big thank you from me. Whatever it is, it's working. I'm a happier woman for it.
Fantastic. Look, I'm a big fan of it myself, Patricia. I would use it. I've recommended it to lots of people. Loads of people get benefits, and there are multiple benefits. So a lot of people who have kids that would be on the ADD spectrum or the autistic spectrum would find that it's extremely calming for them. People who, I've had customers who've had severe pain, who were taking multiple pain medications, can help manage pain with CBD. I have customers with Parkinson's that take it. It helps with the shake, so they're able to write and drive for longer, etc. It's very good for sleep, for calming. It's a brilliant one if you're feeling a little bit anxious or if the brain is busy going to bed. So it does so many different things and really little to no side effects. But the difficult part that I find with the CBD oil, Patricia, is that it's very hard to figure out the sweet spot for everybody, because there are different strengths that you can get, and some people will need stronger and more of it, and some people might need stronger and less of it. So what I'd suggest to people, if you're trying it, play around with it a bit. It's fairly safe to take a good dose of it. The worst that will happen really is that you might feel a little bit sleepy. So play around with it. If you feel it's not working or what the recommended dose on the back is, keep trying, keep upping it by, an extra dose a day, because it'll take a while for you to figure out what the right
what works for you.
Yeah.
All right, obviously Sheila has hit on her sweet spot. Long may that continue for you, Sheila. No name on this. Hi Anneliese. Started taking Nature's Plus collagen peptides as I have plantar tendinitis, but not finding it very good. Is there a better collagen I can take, or would I be better off using Revive Joint Support?
You see, tendinitis is a different thing, Patricia. That's an inflammation of the tendons. And collagen is very good for muscles, tendons and ligaments, but it's not going to do anything for inflammation. And always, if there's inflammation that's not being controlled, it's very hard for the issue to heal. So in this case, maybe it's not the right product for plantar fasciitis or plantar tendinitis. Maybe you need more of an anti-inflammatory approach. And take things like boswellia extract, curcumin extract, all of these natural anti-inflammatories. That might be a better approach, or you could try that with the collagen. And then there is a homeopathic remedy if you can get your hands on it, because unfortunately our homeopathic remedies are fast disappearing. It's called Rutagrav, Rutagrav. It's a very hit and miss one. I tried it myself. Now, I wasn't diagnosed with plantar fasciitis, but I thought that that's what was going on. And I took it for a week and it cleared up, which really impressed me. I didn't think it would work that well. But I have recommended to some customers, and it's brilliant, and some doesn't work at all. So you could try natural anti-inflammatory and Rotagrav and see how you go.
Okay, we'll leave it there. Thank you for that.
Thanks,
And we'll
Patricia.
talk again next Monday. That is Anneliese Dressel. She will put up all of the items that we've spoken about on her website this afternoon, healthhubstore.com. And John Paul will put it up as a separate podcast wherever you get your podcasts, or at c103.ie.